Friends, DrPoonamsvlog, child and newborn specialist from North Goa, Porvarim, and today's question is from Delight Bakes. Okay, so she has asked a question. Hi doctor, I am Diana. Very informative video. I followed all your tips. Thank you, Diana. My question is: my 2-year-old boy has tight foreskin around his penile tip. Local doctor suggested me for a circumcision surgery. Is it important to make one? Is the first question. Second, what are disadvantages if we don't go for the procedure? And he pees comfortably, there is no redness, no infection, or for now please make a video on circumcision. Yes, so that is her question, and it's a very good question. So let's first know the anatomy of the penis before we go for her question, because that is very important for everyone who is watching the video. Okay, so this is let me just fold it. Yes, now if you see, this is the scrotum, this is your penis, okay, a baby or a male's penis, which has a foreskin, which is a skin which is covering the glans. Now the same thing I'll show you in another picture, wherein now we have pulled the foreskin behind. So this is the glans, this is the shaft with the foreskin which is now pulled behind, and this is your scrotum, and this is the anus, right? So now you have an idea about the anatomy of the male genitals. Now coming to what is phimosis. So basically phimosis means the foreskin, that is this foreskin is not able to be pulled back. We are not able to pull it back over the glans. And because we are not able to pull it back over the glans, there are at times difficulty in passing urine. There can be back pressure, there can be problems of this sort, for which we may require a medical management. Now the medical management may be either medical or surgical, okay, but we have to always try the medical management first in children who are usually less than 2 years, or even sometimes even just children just about 2 years. We try the medical management, which are creams which are to be applied over there. We can apply it for around 2 weeks to even 6 weeks, depending upon what type of cream we are applying, but it should be under a doctor's observation. Okay, so they will explain to you how it is to be used, and following that we see the progress. Now the advantage of the creams is that it is non-surgical. Okay, secondly, the creams usually cause loosening of the skin, so it is basically the side effect of the cream that we are using. So we are trying to use the side effect as the effect. Wow, side effect as the effect, right? Yeah, so the skin becomes loose, and because of that it comes back, so we are able to retract it. Now coming to the different types of phimosis. So basically this is what you are supposed to have. When you try to when you try to pull the foreskin behind, here the foreskin is pulled behind, it comes behind. In some of them it comes right behind, and some of them it will come more behind. So this is normal. Now this is what happens when it is not able to come out. So we try to pull it, but it's not coming. See, here it is come out and the glans is seen, but here it's just not coming down, it's not getting retracted, so it is not coming down, and that's why it is just as if it is stuck to the shaft. Here it is coming down, but at the tip it is forming something like cauliflower, and here, okay, here it is come out little bit. So this is the severe one, this is just mild one, but usually it will, and these are both almost physiological in the first 2 years. Okay, this is what many children have till 2 years. So most probably your baby has something like this or something like this. Okay, so when they have something of that sort, the best treatment will be first go for a cream application. Okay, so maybe you can ask your doctor, is there any cream application that I can do? If he says yes, go ahead with it, and they will explain to you how to use it, which cream to use, everything they will use. It depends upon the we cannot just tell the names of the cream, because the application is there, the side effects are there, all that stuff. Okay, so best is to take physical advice from your doctor, and ask them, okay, can I avoid a circumcision surgery because I'm scared of anesthesia, or Now, in spite of applying the cream, sometimes we try once, twice, and if it fails, sometimes recurrence appears. That is, when we apply the cream, following that again the penis has the phimosis reoccurs. In that case, then we have to go for circumcision. Now, why do we go for circumcision? That's because of the back pressure. So when the urine comes out of the penile opening, okay, and because the phimosis, the opening of that foreskin is smaller than the smaller, and is not allowing that much of urine to come out, it will form like a balloon in front of the penis, and then the urine will come out. So because of this ballooning, local infections can take place at that area also. So also they can get back pressure, and there can be effects with the back pressure. There can be effect in the kidney system. So these are certain problems that over long standing children can get, and that's why doctors would advise you to go for a surgical correction if medical correction is not done. So I hope that your answer, you have got your answer. So basically, please request, if in case the medical treatment is not done, Diana, if the medical treatment is not advised to you, then please see to it that it is advised. If you go to a pediatrician, I am 100% sure they will advise you for the medical treatment, okay? And in spite of that, trying the medical treatment for 1 or 2 times, if it is not decreasing, then definitely a surgical treatment has to be done. Also, your treatment presently depends upon whether your doctor has already given you medical treatment which has failed, or if there are any underlying problems for which your doctor is already advising you for a surgical treatment. So do discuss the case with your doctor. I would appreciate if you go to a pediatrician and get an opinion for this. I hope this solves your query as well as query of many more people, because there's something known as physiological phimosis which lasts for around 1 to 2 years of age, and usually in this age, if there is no problem and we don't find that baby is having any problem because of that phimosis, at the same time growth is fine, baby is passing urine without any problem, we wouldn't do anything, okay, other than maybe application of the cream and seeing whether it improves that, okay. But beyond 2 years, if it is showing some side effects on the baby, or we feel it may give a back pressure, some studies are done, ultrasound is done which is showing the back pressure, then we would go ahead with the surgical treatment or refer the baby to a surgeon, because I'm a pediatrician, I'm a medical management person, I'm not into surgical field. So I would refer my patient to a surgical doctor who would take decision regarding the circumcision. So Diana, I hope my video helped you. If it did help you, please give it a like, thumbs up, write your comments down here, share the video, okay, so that many more mothers like you do get helped with this. Bye bye, see you. And also remember, this is the awareness video just to keep you informed about certain medical terms and medical treatment, so that you are confident on taking your decisions further with your doctor's advice. Bye bye.